stay at least 24 hours or extended period. Okay, so that patient is called as inpatient. Patient must stay in the hospital at least same day means we have to report 234 to 236. Suppose if a patient admitted and discharged on the same day means we have to report 234 to 239. Now we are going to discuss about the code description. Now on the first day, on the day of admission, straightforward or low FDM 40 minutes 99221, moderate MDM 55 minutes 99222. Then for high MDM 75 minutes 99222. So these three code sections are initial day code. From the second day, third day, you go for straightforward or low MDM 99231, 25 minutes. Moderate MDM 35 minutes 99232. High MDM 50 minutes 99233. So these code sections are subsequent day. And discharge we have to report 99230 and 30. On the day of discharge, we should report. Am I audible, guys? Am I audible? Am I audible?
Yes, ma'am.
Yes, ma'am.
Does not mention the hospital stay of the patient. So here, time indicate how that means the service the doctor spend how many minutes. That means for less than 30 minutes. 30 minutes. Doctor spend the time to discharge the patient. Some doctors spend to for the discharge surgery or communicate with the patient. So communicate with the patient and explain about the diets, explain about the medications, and will explain about the follow-ups. So doctors spend time to discharge the patient. So this time does not indicate the hospital stay of the patient. Suppose if a doctor spends 20 minutes to discharge the patient means we have to report 99238. Am I right? For 20 minutes of service, 99238. So here, suppose in your document, the discharge time is not mentioned means we have to apply the minimum time. We have to apply the code for minimum time. If in your document, suppose the discharge time, that means how much time doctor spend to discharge the patient. That time is not mentioned in your document means we have to report the code of lesser time. So which one is the lesser time here?
99238.
238. That's it. So we have to report the code for 99238. That's it. So this is a very, very important. Patient admitted on one day and discharged on the another day. For example, patient admitted on Monday and discharged on Friday, like that. Okay. Then, suppose if a patient admitted and discharged on the same day in the hospital. Patient admitted and discharged on the same day. That means less than 24 hours. Admitted and discharged on the same day, less than 24 hours. So here, for straightforward or low MDM, 45 minutes, 99234. Moderate MDM, 70 minutes, 99235. And for high MDM, 85 minutes, 99236. 34 for straightforward or low MDM, 35 for moderate MDM, and for high MDM, 99236. So if a patient admitted and discharged on the same day means should not apply the discharge code separately. Please take a note. The patient admitted and discharged on the same day means should not apply the discharge code separately. Patient admitted and discharged on the same day means should not apply the discharge code separately. Did you understand? Did you understand, guys? Sorry? Guys, am I audible? Am I audible? Your voice is
Yes,
breaking
ma'am.
actually. Okay. Someone asking question. Your voice is breaking. Could you repeat the question? What's your doubt? Okay. So this is important to know. So patient admitted, this in notice explained in this page. I just explained the concept now. Patient admitted and discharged on the same day, but patient stay in the hospital less than 8 hours. Patient admitted and discharged on the same day, but stay in the hospital less than 8 hours. Less than 8 hours means we should apply the initial day code. That means 99221 to 99220. 99, take a note. Take the code ranges also. Patient admitted and discharged on the same day, less than 8 hours. Patient stay in the hospital less than 8 hours only. So we have to apply the initial day code. So the code ranges are 992212 to 99223. I think so. Yeah. 21 to 22. Suppose patient admitted and discharged on the same day, but more than 8 hours. Patient admitted and discharged on the same day, but more than 8 hours means they have to apply the previous code, 234 to 236. Take the code ranges also. Initial day. What is the code section for initial day? What is the code section for initial day? 21 to 23. What is the code for the patient admitted and discharged on the same day, but more than 8 hours means? 234 to 236. 234 to 236. Take a look. Very, very important. Here, triple R. So this triple R concept has been followed for consultation procedure. So R, request, refer, render, and report. Request, refer, render, and report. Request. This code sections can't be able to report for Medicare patient. These consultation codes are not applicable for Medicare patients. What is the meaning of refer? Refer request means a doctor refer a patient for another doctor. A doctor refer a patient for another doctor. For example, I am a patient, so I am going to meet a doctor. That doctor refer me another doctor. That doctor refer me another doctor. That is reference. And requesting means doctor ask the help of another doctor. Both are same, but usually reference will happen in OP setting. Reference will happen in OP setting. Request usually happen in IP setting, inpatient. Okay. So here in reference, actually doctor refer another doctor means patient move from here and there. Patient is move from here and there. But in request, patient is admitted into the hospital. Doctor come to the requesting physician come to meet the patient. For example, patient admitted into the ED department, then the ED physician request the help of ortho. A patient admitted with the skull fracture in the ED department. So the ED physician requests the help of ortho. So that physician come to meet the patient and perform the service and give the report. That's it. So here, if it is a reference or if it is a request, whatever it is, that requesting physician or referring physician must give the signature in the patient document. That means, in simply, if you are in the consultation report, you definitely can able to see the requesting or referring physician name or signature. In a consultation document, you definitely can able to see the requesting or referring physician name definitely present in our consultation report. So after that reference, that referred physician examine the patient, that is render. Examine the patient. Okay, so examine the patient and get the report, that means result, then that report has been transferred to the requesting physician. Okay, so I am going to meet any one of the doctor, that doctor refer me another doctor. Then the second individual who examine me and find out the result, and the result has been transferred to the primary physician. Did you understand the meaning of triple R? Render means examination. Once after completion of examination, that doctor get the report and that report has been transferred to the another doctors. Did you understand?
Yes, ma'am.
ESR the peoples comes under the Medicare patient, comes under Medicare.
And say one more time, ma'am. Yes, are the patient.
ESR the patient. In HIPICS and the billing, we will explain about that. 65-year-old patient, ESR the people, disabled people, handicap. Disabled people comes under this Medicare. Medicare. This is one of the policy, governmental policy, Medicare. This. And outpatient consultation. So there are two classification in consultation: outpatient consultation and inpatient consultation. So outpatient consultation code ranges are 242 to 45. Here also we have to apply the code based on the MDM or time. Straightforward MDM 20 minutes, 242. Low MDM 30 minutes, 243. Moderate MDM 40 minutes, 244. High MDM 55 minutes, 245. So these are the code ranges for OP consultation. OP consultation. Same like that for IP consultation. The service, let's please mute yourself. The service provided by the doctors in hospital. So the code ranges are 52 to 55, 252, straightforward MDM 35 minutes, 253, low MDM 45 minutes, Double line 254. More guys, please mute yourself, please. Moderate MDM 60 minutes, double line 254, and high MDM 55 minutes, for 80 minutes, double line 255. So these are the code ranges for inpatient consultation. So what are Radha, please mute yourself. What is the important to understand in our document for consultation?
Inpatient or time.
That is the thing to select the code level. I am asking about how to easily identify that the report is consultation report. Sign. Name of the requesting requesting or referring physician name is present at the top of the chart, or at the end of the chart we can able to see the requesting or referring physician's signature. That is important. When we are seeing the consultation document means you can easily find out the document at first. You can easily find out this is a consultation at first. How requesting or referring physician name is present at the top of the chart or the ending of the chart. Did you understand? Understand?
Yes.
The emergency department. Emergency guys, as I told you already, they have to apply the code based on the facility. In which facility patient receives the treatment. So ED is also the one of the dedicated area present in hospital. ED also one of the dedicated area that present in our hospital. So, suppose if a patient admitted into the ED department means we have to fetch the code from ED. Should not consider as a hospital. Should not consider as a hospital admission. So here, the entire E&M service codes should you report based on the place of service. Because ED is one of the dedicated area that are present in our hospital. Suppose the patient admitted into the emergency department means they have to apply the code from emergency department only. So the code ranges are 99281 to 99285. So time is not a key factor for emergency department. Time is not a key factor for emergency department. Example, 99281 for I will explain you later about 99281. 99282, emergency department, straightforward MDM 282, low MDM 283, moderate MDM 284, high MDM 285. Straightforward 82, low 83, moderate 84, high MDM 85. So here 99281 is may not require the presence of physician. So patient admitted into the emergency department. So for that service, physician is patient take poisoning. Okay, patient take poisoning admitted into the emergency department. So here, to clear the stomach, doctor is not a necessary thing. So doctor present is not necessary. So here, doctor is not necessary. So just staff nurse will complete the procedure without presence of physician. So physician presence is not requiring. So usually that procedures, that service has been completed by nurse means go for 99281. So 99281, this is a code for nurse. We already discussed one of the nurse code. What is that? We already discussed one nurse code.
99211.
211.
Super. 99211. That service provided by nurse in which facility? In
Outpatient.
OP. Yeah, correct. Outpatient. So 99211 for OP. Service provided by nurse in OP. So here, this is also the one of the code for nurse service, but in emergency department. Without presence of physician, nurse will complete the procedure. For example, to clear the stomach, to remove the casting. So for these cases, not require the presence of physician. So that's why staff nurse or trained nurse will complete the procedure. So this is a code for nurse. This is 99280. Did you understand the emergency department? Did you understand? Please say yes or no.
Yes, ma'am.
And other emergency service, EMS, emergency medical system. So this is a example EMS, example ambulance squad. Take a note. EMS means emergency medical system. Emergency medical system. So that give a initial stabilization to before to reach the hospital. EMS that give a initial stabilization service to before to reach the hospital. Example, ambulance squad, first aid squad, ambulance squad, first aid squad. These are the example for EMS service. Ambulance squad, first aid squad. These are the example for emergency service. Okay. Then critical care service. This is also the one of the area that are present in our hospital. This is also the one of the area that present in our hospital. So critical care service, first 30 to 74 minutes, 99291. For each additional 30, 99292. First 74, from 30 to 74 minutes. From, this is a critical care codes are used to report based on the time. It's a time-based report. So for first 30 to 74 minutes, 99291. Beyond the 74, for each additional 30 minutes, 99292. Beyond the 74, for each additional 30 minutes, 99292. Okay. Now, here we have a table. By using of this table, you can easily fetch the flow. For less than 30 minutes of service, should report the appropriate E&M code. If the total duration of critical care service has been less than 30 minutes, should report the E&M code. From 30 to 74 minutes, should report 99291. 75 to 100, 75 to 104, 99291, 99292 into 2. From 105 to 134, 99291, 99292 into 3. Guys, see that the table. For the each 30 minutes, the unit of the add-on code only increased here. into 1, into 2, into 3, into 4, into 5, into 6, like that. For each additional 30 minutes, the unit of the add-on code has been increased here. Now try this. What is the code, sir? What is the code for 125 minutes? 125. Use my screen. What is the into 2? Correct. So the correct 125, that is present between 105 to 135, 134. Am I right? So 125 minutes is present between 105 to 134. So the corresponding code sections are 99291, 99292 into 2.
Ma'am,
So here is
can you
for
repeat
less than 30 means appropriate. Suppose if a patient admitted into the observation means go for the observation unit. Suppose if a patient admitted into the OP means go for OP, like that. Okay, so critical care service code should not report for less than 30 minutes. For less than 30 minutes means we should consider as a outpatient or either a observation. Based on the doctors definitely measure that. Doctor definitely mention the days of service. Clear now? Clear? Blood. Okay, measure the oxygen level. Pulse oximetry is also find out the exact volume, that means exact range of oxygen. And capnography, it's measure the carbon dioxide in our blood level. So blood gases, in that blood gases, they measure how many type of, what are the gases are present in our blood, and what is the, and its ranges has been displayed by using of this device. Okay, that is simply show the measurement of that means measure the volume of oxygen and carbon dioxide in our blood. That's it. Then a gastric intubation means the doctor insert the tube in our stomach through mouth. Okay, that is gastric intubation. The tube has been inserted.
Yes, ma'am. And vascular access procedure as well, ma'am.
Vascular access procedure is nothing but for injection, for infusion, they are placing the port in our wrist. Am I right? Wrist are in that carpal vein. They insert a port. See that below image. If you are admitted into the hospital means they are inserting the port in the carpal vein. Am I right? So that is vascular procedure. For infusion, they doctors insert the port in our arm for a continuous infusion. That is also included with the vascular procedure. Shall we move to the next?
Okay, ma'am.
Okay. So vascular access procedure is nothing but they are access the particular vein for infusion by using a port. Then this is an excluder service. Excluder means we have to report separately. The service are not included with the critical care. Suppose during critical care service, if a doctor perform an endotracheal intubation, CPR, and a cardioversion. CPR, I think everybody knows that. CPR and the cardioversion is performed means we should report the code separately. Endotracheal intubation means a doctor make a tube through mouth to trachea for temporary respiration. Doctor insert the tube through mouth to trachea for temporary respiration. Take a note.
And cardioversion means?
Cardioversion is, that is a below first image. It's like a defibrillator to stimulate the heart. In our left below, there are two images. In that left side image is a cardioversion, then the right side image is a CPR. Then the above image is a endotracheal intubation. Did you understand now?
Yes, ma'am.
No. So nursing facility is also the one of the rehabilitation medical treatment center. Rehabilitation and a medical treatment center. If a patient admitted into that facility means they are taking care of that patient, and once the patient has recovered from the condition means the patient will discharge from that facility. This is also the one of the facility. In that facility, staffed and trained medical professionals are present. Staff nurse and trained medical professionals are present. If a patient admitted in this facility means they are taking care of that patient. Once the patient has recovered from the condition means patient will discharge from that facility. Okay, so guys, as I told you already, we have to apply the code based on the place of service. Here the place of service is skilled nursing facility. If a patient admitted into the facility on the first day, 993042 99306, for the subsequent care visit, on the day of admission, we should report the patient is admitted into that facility. On the first day, we should report 3042 306. From the second day, 3072 310. On the day of discharge, we should report 3152 316. You're just focusing on the facility. Here, in which facility patient receive the treatment? That's it. In which facility patient receive the treatment? So 99304 for straightforward or low MDM, 25 minutes. 305 moderate MDM, 35 minutes. High MDM, 50 minutes. 306. These three code sections for initial day. On the day of admission, we should apply the code from these code sections based on the MDM. Then the subsequent nursing facility, straightforward MDM 10 minutes 307, low MDM 20 minutes 308, moderate MDM 30 minutes 309, and for high MDM 45 minutes 310. These code sections for subsequent day. From the second day, third day means we have to apply these code sections.
Ma'am,
And same like this.
ma'am, in some cases, the timing is higher, but then the intensity, that is whether it is straightforward or level, that is varied. So in that case, which one should we go for?
Suppose if the level that satisfy the low MDM, but the time it satisfy the moderate MDM means choose the highest one. Okay, level that is satisfied the low MDM that is satisfied low, but the time duration is satisfied that high moderate means go for the highest one. So you most probably if some payers follow the instruction based on the time. So usually if two levels satisfied in another one, time is satisfied in another level means they have to apply the code based on the time. Code for the highest time. Okay? But some payers follow MDM. It will differ based on the MDM, based on the project wise. But in your CPC exam, they will mention time or MDM only. But in your real-time coding, if you are facing some payers, they are instruct the coders to follow the codes based on the MDM. But some payers instruct the coders to follow the time. So based on the payer, it will differ. Okay. But in your CPC exam, they definitely ask either MDM or time only. Suppose if both are documented means, you simply report the code based on the time. And the nursing facility, if a patient is discharged from the nursing facility, here also the time spent by the provider to discharge the patient from the facility. This here also, this is a time spent by the provider to discharge the patient from the facility. Same like that, 30 minutes or less, 315, more than 30 minutes, 316. If a time is not mentioned means, how can we report? Time is not mentioned.
Less than 30 minutes.
Less than 30. So go for 99315. Less than 30 minutes. 99315. That's it. Then domiciliary rest home custodial service. So these codes has been deleted. Now all of the service comes under the home or residence service. Okay, so domiciliary rest home custodial. Suppose if a doctor give the treatment for the patient in hospital apart from hospital, that means if doctor give the treatment for the patient in hotel, ship, then during air travel, that means that it comes under domiciliary rest home. But all are considered as a home or residence service. If a doctor give the treatment for the patient at a temporary lodging, hotel, campground, and a hospital or a ship, a cruise ship, means that it comes under the single category, home and resident. Okay, take the example for home and resident service. These places are considered as home or resident service. We have a classification of new patient and established patient. For straightforward, new patient, straightforward MDM, 15 minutes of service, 341. Low MDM, 30 minutes, 99342. Moderate MDM, 60 minutes of service, 99344. And for high MDM, 75 minutes of service, 99344. So these are the code section for new patient, and the same like that, the following code section for established patient. So straightforward MDM 20 minutes 347, low MDM 30 minutes 348, moderate MDM 40 minutes 349, and for high MDM 60 minutes 350. So these are the code section for established patient. And prolonged service. So prolonged service means doctors spend extra time apart from the original time. We already discussed that 99417 yesterday. 99417 is the OP prolonged service code. For each 15 minutes. For OP, new patient, 40 minutes, 40 or 60 minutes. Established patient means that is 40 minutes. 40 minutes. Apart from that original time, if a doctor spends extra time, means we have to apply the corresponding add-on code. So we already discussed that 417 for each additional 15 minutes. OP and 418 for each additional 15 minutes in IP. 417 for OP for each additional 15. If a doctor spend a extra time for a patient in IP setting means go for 418. Then the previous code section or this one. Prolonged service without direct contact on date other than the face-to-face ENM service. See that the code description 99358. Prolonged evaluation and management service before, under, after direct patient contact. Before meet the patient or after meet the patient, if a doctor spend extra time means we have to report these code. Okay. So for example, this is a without direct contact. Doctor did not meet the patient directly. For example, I am a patient. So I'm going to meet him. I contact with because in our countries, if you want to meet the doctor means you can directly go to the hospital and meet the doctor. But in another country, we can't able to meet the doctor directly. If you have any problem means you must make a call for healthcare customer service. They will connect with the doctors. So doctor will give some instruction. Doctor give some instruction through the phone call or a video call before he come to meet the doctor. So now I am a patient. Before I am going to meet the doctor, I contact with the patient. The customer care give a connection for the doctors. The doctor communicate with us, and before I have a hyperemesis. I have suffered by the problem of hyperemesis. So before I am going to meet the doctor in hospital, they give some instruction to control the emesis. So like a first aid, they give some instruction for me to control the hyperemesis. Before I am going to meet the doctor communicate with me and give the instruction regarding of my condition. After that, I am going to meet the doctor. Did you understand the meaning of before? Did you understand? Before I am going to meet the doctor communicate with me and give some instruction for me. It's like a first aid. It's like a first aid for me. And after that, I do that process, and after that, I am going to meet the doctor. Did you understand the meaning of before?
Yes,
Then after means after direct patient contact. That means, so I got the treatment from the doctor. I got the treatment directly from the doctors, and I reached the home. And after that, I facing some complication. So morning, I got the treatment from the provider. Evening, suddenly I have some more complication. I have a new complication, or otherwise the complication will rise. Means in this now doctor communicated with me after direct meeting, after direct communication between the doctor and the patient again communicate with the doctor. Okay, so all of these services are provided by the doctors through phone call or video call only. That is before and after direct patient contact. Before I am going to meet the doctor gives some instruction. After that, he give a face-to-face service. Then after completion of face-to-face service, Again, I am communicate with the same doctor. The doctor will give some instruction through the phone call. So that is the meaning of before and after. Did you understand the meaning of before and after, guys? Please reply me.
Yes, ma'am.
Okay. 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 For the first hours, 358. For each additional 30 minutes, go for 359. How can we report the code for 2 hours? How can we report the code for 2 hours?
99358 and
359 into 2. 359 into 2. Super, super. 99358, 99359 into 2. For first 1 hour, 99358. Then remaining 30 minutes in 1 hour. So for that, 99359 into 2. Okay. Now, prolonged service by clinical staff. Here, the prolonged service given by the clinical staff under the supervision of doctors. Under the supervision of physician, clinical staff provide service. So, these 2 core sections also used for nurse service. These core sections also used to report the service of clinical staff, nurse, training doctors, like that. Okay, training doctors are not a resident physician. Okay, training doctors are not considered as a resistant physician. So they are considered as a clinical staff only, because they have to complete their training and complete the course. Then only they will give approval to practice for that physician. So for first 1 hour, 99415. For each additional 30 minutes, 99416. For first 1 hour, here the prolonged service provided by clinical staff under the supervision of doctors. For first 1 hour, 415. Then for each additional 30 minutes, 416. Did you understand these 2 prolonged service codes?
Yeah.
Okay. So we already discussed that this 417 is for OP prolonged service and 418 for IP prolonged service. That's it. So each code should you report for each additional 15 minutes. Each additional 15 minutes. Standby service. Okay, one more. I want to ask. Okay, one question. I have one question. Please try to answer. You are a doctor. So everybody should consider as you are a doctor. I am an anesthesiologist. We are working together for the same surgery. I am giving a anesthesia for a patient. Then you are starting the procedure. At the middle of that procedure, you decide that the procedure will take extra time. You are a surgeon, guys. I am an anesthesiologist. I give anesthesia for you. Anesthesia for the surgery. You are starting the procedure, and at the middle of the procedure, you decide that will get extra time. So for that extra time, what modifier would you append for that surgeon? 22. 22. Others, is this right? Is this correct or not? Yes. During the surgery, if surgeon spend extra time or work, means we should append modifier 22. Am I right? So surgeon will their extra work by using of modifier 22. What about me? I am also spending the extra time. Am I right? If the surgery time is extended, means the service of anesthesiologist also extend their service. Am I right?
Yes, ma'am.
So for my service, how can we report?
Standby service, ma'am.
standby service. So in that case, apart from that surgeon, by the request of physician, if another physician spend extra time and work means, we should report the standby service. So by the request of surgeon, anesthesiologist spend extra time and work for that patient means we should apply the code of standby service 99360. Did you understand the meaning?
Yes, ma'am.
Take this definition. Okay, take this definition. As well as take the same example in your own language. In your own language, please take the meaning of that standby service. Once you complete it, please let me know. 99360 for each 30 minutes. 99360 for each 30 minutes. So suppose if a doctor spend 2 hours extra means we should report 99360 into
3.
4. For 2 hours means for 4 into 4. 99360 into 4. Okay. Then medical team conference. So medical team conference is nothing but it's just like a meeting. So the conference, in that conference, more than one, that means minimum 3 doctors are present from different specialty. So different specialists are present in that conference. Minimum 3 different specialists. For example, ortho, neuro, then nephro or pulmonologist. So like that, minimum 3 professional must present in that conference from different specialty. Okay. In that, who they are taking the decision. They are taking the decision to take care of that patient. They are planning the treatment. They are taking the decision and planning the treatment, how to take care of that patient. Okay, that is a team conference. In that team conference, if a patient and their family members is present means go for 99366. If a patient and their family members not present means go for 367 to 68. 1 minute, I show you. See that medical team conference. In that conference, patient and their family members is present means we should apply 366 for 30 minutes or more. So 30 minutes is must. Even 29 minutes. The patient or family members, doctors only present means go for 99367. 99368, non-physician. Non-physician means apart from doctor, lawyers, police means they are comes under the non-physician. So patient is accused. So doctors want to discuss their health condition with the police. Am I right? So like that. So take the example for non-physicians. Apart from family members, if in that conference, police, lawyer, they are present means they are comes under that non-physician. 99360. Did you understand the meaning?
Can you explain once again 366 and 361, ma'am?
360.
366 and
7 and 8. Am I
367.
right?
66 and 67, ma'am.
Okay. With the
And 366.
Okay. In that different, that means minimum 3 professionals must present from facility, different speciality. The patient and family members also present in that conference. Patient and the family members definitely present in that conference means go for 66. 67, without the patient, doctors only present in that conference. For doctors only participate in that conference. That is the difference for 66 and 67. Did you understand now?
Yes, ma'am. Okay, thank you.
Okay.
68, ma'am.
68, apart from family members. Non-physician, like policeman, lawyer. So, for example, if a patient is accused, so doctors want to explain their health condition with the policeman. Am I right? So, non-physician, example, lawyer, policeman, or participate in that conference means 368. So, actually, what is the purpose of this conference means? They are taking the decision and they are discussing the treatment of that patient. That's it. Did you understand?
Yes, ma'am.
Did you understand?
Even the insurance persons also will come under 99368, right, ma'am?
Yeah. Apart from family members. Apart from doctors, if any other third person means they are comes under 368.
Okay.
Okay?
Yes, ma'am.
Then care plan oversight service. Okay. Care plan oversight service. So here, patient take the treatment in hospital settings. When a patient need care from many different professionals means patient receive the treatment and the patient they are taking care of that patient in hospice setting. So when a patient need care from many different professionals means they are giving the treatment, they are take care of that patient in hospice setting. That is called as care plan oversight service. The core sections are 99374 to 9938. Yes?
What is hospice, ma'am?
Like a guest, like they are treating as a guest. So if a patient admitted into the hospital means they are treating as an inpatient. If a patient receives the treatment under any facility means based on that the patient is considered as that a particular facility patient. So hospice means they are treating as a guest and give the treatment for a few or 2 or 3 days only. Few days only they are take care of that patient. Okay? Did you understand?
Yes, ma'am.
Please say yes, ma'am. So 99374 for 15 to 29 minutes of service, 99374. From 30 minutes or more, how many times they spend with the patient? Patient present in hospice settings. Then if in that settings, if a doctor spend 15 to 29 minutes of service means give a 15 to 29 minutes of service means 74. More than 30 minutes means go for 99370. 99370.
Ma'am, someone is waiting for you in the waiting room.
Okay. Thank you. Thank you. Did you understand any doubt?
None.
74 to 80. 74. Supervision of patient under care of home health agency. So, patient not present in home. Okay. Patient not present in home. Home health agency. So that means so they are taking care of that patient. Actually, sorry, patient not present. That means supervision of patient under care of home health agency in home. Patient also present in home. 1 minute. So, for example, if a patient is a mentally affected patient, so their family members appoint a person to take care of that patient. Appoint a nurse or any other person to take care of that patient. Okay, but the patient is also present in home. The home health agency take care of that patient. So that is 74 and 75. But in this, patient, for example, okay, I'm a patient. So okay, 1 minute. A patient is a patient is suffered by mental related condition. Their family members have some important work or due to insufficient time, the family members can't be able to spend their time with that patient. So in that case, they are appointing one person to take care of that patient. So that person, that a staff nurse or a trained professionals, whatever it is, they are come to stay in the home of the patient and take care of the patient. Did you understand the home health agency? Did you understand
Yes,
that? But in that hospital setting, patient transfer to the specific facility. Patient not present in home, so patient admitted into the some center. Center. In that center, they are taking care of the patient for a few hours or for a few days, like that. In that above code, the trained professional come to the patient home and stay in the home and take care of the patient. But in that 77 and 78, patient admitted into the hospital setting, okay, like a center. In that center, they are taking care of the patient for a few days. That is 77 and 78. So same like that, 15 to 29 minutes, 77, 30 minutes or more, 78. Suppose 79 and 80, nursing facility. Guys, actually, we have a variety of classification in that home health center. So in that cases, usually in nursing facility, patient admitted into that facility. Once the patient recover from the condition, patient will discharge from the hospital. But in these hospital setting, the patient, it's not a matter. Condition is cured or not, it's not a matter. They are just take care of the patient for a few days only. For example, if a family members want to okay, family members in a family, their mother, his husband and wife want to due to officially want to travel from one country to another country. Okay, in that family, disabled people are also present. Okay, in that family, disabled people are also present. But officially, husband and wife want to officially travel from one country from India to US or from US to India. So in that case, that disabled people is admitted into that hospital setting. For few days, they are taking care of the patient. Once their husband and wife reach the country means, they will discharge the patient from that hospital setting and take care of the patient in their home. Did you understand now? Did you understand?
Yes, ma'am. Yes, ma'am.
But here, suppose if that patient admitted into the nursing facility same like that, so they just take care of that patient for a few days only. So family members want to travel for another country or want to due to some personal reason, so they are admitted into the particular facility. After few days, they will discharge from that facility and the patient is come to the home again. That's it. So supervision of nursing facility means go for 15 and 29 for 379, 30 or more means go for 3. Okay. Then preventive medicine. This is a very, very, very important question. Preventive means doctor, we are taking the service to prevent from the condition. To prevent from the condition. This is one of the precaution. One of the precaution. Example, counseling regarding to prevent from the illness of genetical disorder or other screening, regular example mammogram, then like that. So screening procedures and regular checkup. Now patient get the counseling regarding of that hereditary diseases like that. So preventive medicines is a very, very important question. Here we have a 2 classification for new patient and established patient. 99381 to 99387 for new patients. 99391 to 97 for established patient. 99381 to 87 for new patient. 99391 to 97 for established patient. Here, for new patient, for patient ages younger than 1 year, 381, 1 to 4 year, 382, 5 to 11 year, 383, 12 to 17 year, 384, 18 to 39 years, 385, and 60 to 40 to 64 years, 386, and 65 year and older, 387. Here we have to check whether the patient is a new patient or established patient. Next, you have to check the patient age. Based on that, we have to select the appropriate code. Same like that, here also we have a code for established patient. Here also we have to check the patient age. It's the simplest one. What is the guidelines means? This one. Very, very important. Using of modifier 25. Suppose if a patient take preventive medicine alone, if a patient take preventive medicine alone, take preventive medicine alone, no need of modifier. Suppose during the same time, if a patient take the service of preventive medicine and vaccine injection, okay. So vaccine codes are present in medicine chapter. I think everybody know that medicine is almost completed for you. So vaccine codes are present in medicine. So doctor, before going to take the vaccine, doctor give the service, preventive service means you should up and modify 25 with the preventive code. Preventive with the ENM means should up and modify 25 with the ENM. Suppose all of the above during the same time. If a doctor gives preventive medicine, ENM service and a vaccine means except the vaccine, with the rest of the code section should up and modify 25. Okay, did you understand? Did you understand, guys?
Yes, ma'am.
Okay, take a note, very, very important one. Take a note. Compare vaccine code that is present in medicine chapter. That's why without the vaccine, with the rest, because preventive medicine code and ENM codes are present under the chapter of evaluation and management service. So that's why here we are appending modify 25 with these two codes. Vaccines from medicine chapter. We already discussed that 24, 25, 57 modify only for this ENM service. With the rest of the chapter, we can't apply that modifier. Here, this is a counseling code for preventive medicine. Counseling with the preventive medicine. Preventive medicine counseling. In that counseling, they are discussing about the risk factors, how to reduct that interventions. So everything should explain, everything should discussed during that counseling. So don't worry. For doctors directly give the name of the counseling. So the name of the counseling is preventive medicine. So that is the reason. What is the reason for that counseling? For preventive medicine. So the name of the counseling directly documented by providers, don't worry. So for approximately 15 minutes, approximately means, so this is not an exact time. So approximately 15 minutes, 409. For 30 minutes means 408. This is not an exact time. Here usually doctor denote the time in approximation only. Doctor gives the approximated reported only. For 45 minutes means go for 403. 60 minutes means go for 404. So these code section for individual counseling. Individual means one-on-one session. Doctor give the counseling. That means doctor give a counseling for a patient, for a single patient at a time. Doctor give a counseling for a single patient at a time. That is individual counseling. Then the following code section for behavioral change intervention service. For smoking, 1 minute. For smoking, here doctor give a counseling. Here this is also the individual counseling. But what is the reason for the counseling? For behavioral changes. For example, for smoking and tobacco, for alcohol. Okay, so this is the counseling regarding of smoking and alcohol. Then the previous counseling regarding for preventive medicine. So you have to check the reason for that counseling. Reason for that counseling. Here, smoking and tobacco. If doctor just spend greater than 10 minutes, greater than 3 minutes to 10 minutes. 3 minutes. So we can't apply this code for 1 or 2 minutes. Okay, 1 or 2. Greater than 3 minutes from 4 minutes. From up to 3 minutes, we can't apply the code. Up to 3 minutes, we can't apply the code. From 4 minutes to 10 minutes, 406. More than 10 minutes, 407. These code section for smoking and tobacco counseling. And 408, 409 for alcohol. Alcohol, same like that. 15 to 30 minutes, 408. Greater than 30 minutes, go for 409. So all of these 4 core sections are also for individual counseling. These 4 core sections for individual counseling.
Ma'am,
Yes?
these codes have the star and audio symbol near it, ma'am. Does that mean that these codes are applicable only for the tele-counseling?
Not only the same code can be able to perform as a in-person as well as a phone call. Telemedicine means, suppose if a doctor communicate with the patient, give the counseling through phone call, means it is acceptable to report this code. Not only for the telemedicine, as well as suppose if a doctor give the counseling for face-to-face counseling also, we can apply the code. For face-to-face counseling, as well as for if a counseling given by the provider through phone call or video call, means it is acceptable to report both of them. Okay?
Yeah.
Now, then this is a code for group counseling, preventive medicine, group counseling. So you have to check the reason of that counseling, and if next you have to check whether the counseling is given by the provider individually or a group. So these 2 core sections for group counseling regarding of preventive medicine. Same like that, approximately 30 minutes for 99411, approximately 60 minutes 99412. Approximately 30 minutes 99411, approximately 60 minutes means go for 412. So this is a group counseling for preventive medicine. Okay. Any doubt? Any doubt? Any question? Face-to-face service. Non-face-to-face means patient and the doctors does not meet directly. So they are communicate with the phone call or video call, like a telemedicine. Like a telemedicine, they are communicating with the phone call or video call. Here these are the code section. Now we are going to discuss one by one. Non-face-to-face service through phone call. Telephonic service without image. That means this is a audio communication only, not a video. Okay, it's not a video communication, just a audio communication between the doctors and the patient. Here for 5 to 10 minutes 41, 11 to 20 minutes 42, 20 to 30 minutes of service 99443. So from 41 to 43 core section for communication between the doctors and the patient through phone call. Just a audio conference only. Then this is a audio with the video. Online digital service. So patient, this is the audio with the video. Online digital evaluation. So 5 to 10 minutes 99421, 11 to 20 minutes 99422, 21 minutes or more 99423. Okay, 99423. So these are the core sections for online digital E&M service, both audio and video. And here this is also both communication. That means both audio and video, either telephone service or either online service, whatever it is. What is the difference means? Here in 99446, check the fourth line. Consultative physician or other qualified healthcare professional, including verbal and written report to the patient. So they are communicating with the provider. So actually patient and the doctors, they does not meet directly. This is not a face-to-face communication. This is not a face-to-face communication. They are communicating with the phone call or video call only. It's not a in-patient communication. In-person communication. So here doctor communicate with the patient and give the verbal and written report. Means we have to report the code from 46 to 40. Doctor communicate with the patient and give the instruction and give the service through verbally as well as written report. Written report also transfer to the patient mail. Transfer to the patient mail. That is verbal and written report. First 5 to 10 minutes, 46, how many minutes they are spending, they are communicating. So 5 to 10 minutes, 46, 11 to 20 minutes, 47, 21 to 30 minutes, 48, 30 minutes or more, 49. So these are the code section for, that means non-face-to-face service with the verbal and written report. So here patient just give the query through the mail, and the doctors will also give the response for that patient. That's it. So doctor did not communicate with the patient. This is not without verbal communication. Without verbal communication, they are communicate with through written report only. Did you understand? Did you understand?